Welcome, I'm Amy Friesen of Tea and Toast, and today we're joined by Krista Duncan of Parkinson's Canada. We're speaking about Parkinson's disease, signs and symptoms, as well as what help and support is available. Enjoy! Welcome everyone. My name is Amy Friesen and I am the founder of Tea and Toast here in Ottawa. And we support families through the senior living journey, whether they're looking to stay at home safe, whether they're looking for retirement or long-term care. And we help educate families to make sure they have everything they need for their journey, which has brought us with Krista Duncan today from Parkinson's Canada. Thanks so much for joining us, Krista. I appreciate it.
Thanks so much for having me. It's nice to be here.
And I'm going to let Krista introduce herself, and then we're going to get into some details about Parkinson's and how you can best help your loved one or help yourself and set yourself up for success with some strategies and some knowledge around the whole subject. So Krista, could you go ahead and let them know a little bit about you?
Absolutely. Thanks again, Amy. So my name is Krista Duncan, and I'm a donor relations associate here at Parkinson Canada. And previous to that, I was a community engagement coordinator working in the community, helping support people here in Ottawa and Eastern Ontario with support groups, local education events, exercise programs, and things like that. And now I am a part of our philanthropy team.
Wonderful. So I'm gonna do a little bit of a Q&A with Krista so we can get some details about Parkinson's, about different strategies and things to look at. And then we're going to take questions in our chat box. If you're interested, we'll probably do the questions at the end. So feel free to put them in there throughout our journey today, and then we can answer any specific questions. So Krista, maybe we can start with what is Parkinson's disease? Can you give us an overview of what it is?
Absolutely. And that is a bit of a loaded question, as Parkinson's is different for everybody that has Parkinson's. We do like to say that Parkinson's is like a fingerprint. No two people are the same. So I'm sure at one point we'll be talking a lot about the symptoms. You might experience something very differently from the next person. But that said, Parkinson's is a chronic progressive neurodegenerative disease. So essentially what that means is it's not fatal, but it is chronic. So it's something that you will live with for the rest of your life, and it is progressive. How that progresses, again, can be very different for every person. It might progress more rapidly for one than the other. Again, it might progress in the sense that you get new symptoms where somebody else doesn't, but it will progress nonetheless. It's just a matter of what that looks like. And neurodegenerative in the sense that the cells in your brain that produce dopamine, those are what are slowly dying off. Now, in all of us, those cells will die off eventually over time. However, in people living with Parkinson's, they die off that much quicker. And those dopamine cells are what send signals to the rest of our body. So once those start dying, those signals get much slower. So if your brain is trying to tell your legs you want to walk to the other side of the room and there isn't as much dopamine, that signal is going to take a bit longer. So that movement is going to be a little bit longer. And that's when you start seeing those signs and symptoms, is when those dopamine cells are dying off. So that's the neurodegenerative part of Parkinson's disease.
Krista, when you talk about like the signal being slower, some of us, like I've come across it in my profession, but also are some of our viewers. Does that what people can call like the freezing action of Parkinson's? Is that what they call freezing, or is that just like another type of symptom?
Yeah, freezing is its own symptom. So that is something where you're literally frozen in spot. Oftentimes people will say it's when they get up from, maybe they get up from a chair and they physically can't move. A lot of times people have said it's when they're going through a doorway, or there's a change from carpeting to tile or hardwood. When there's that change, there's something about it that causes them to freeze. So as a care partner or someone helping someone with Parkinson's, the best thing you can do is just to wait it out and get the brain onto something else. Some people have said singing a song, just sing your ABCs or something to get the brain away from focusing on trying to do that. The worst thing to do is to try and pull the person and say, oh, come on, let's get going. It just takes a few minutes. There is actually, in terms of freezing, I had some folks say that it happened the same time or the same place getting up from that chair as I mentioned. And they would freeze every time. So they put a piece of red tape on the ground. So there was a visual cue to step over, and that seemed to help. And another person said they used a laser. So you and I, Amy, were talking about our cats. Mine made a cameo earlier. So if you have a pet and you have one of those little lasers that you can put on the floor, having that visual of something to step over helps with the freezing. But the freezing itself is actually another symptom of Parkinson's, separate from the slowness of movement and the slowness of thought.
Interesting. Thanks for that clarification. While we're talking about kind of signs and symptoms as well, can you talk about, like, are there other signs and symptoms that we should be looking out for?
Absolutely. And it's interesting when you say looking out for, because the motor symptoms are those that we see and those people are looking for. So those are things like the tremor, and that's what a lot of people will think of when they think of Parkinson's immediately, is that tremor. But there's so much more going on. There are a lot of non-motor symptoms, which oftentimes people have said is what are the most bothersome. So those are all the symptoms that we don't see, and that can be anything from constipation, loss of smell and taste, depression, anxiety, and apathy are big ones. Um, Double vision, there's sleep disorders such as REM sleep disorder. That's actually a possible biomarker for Parkinson's, which means it's one of the things, if you have before diagnosis, they know that can more often than not lead to Parkinson's. So REM sleep disorder essentially is acting out your dreams because you're not getting that same REM sleep. Your brain is not in rest, the same as someone that does not have Parkinson's. You're acting out those dreams. So oftentimes, if you're still sharing a bed with someone, they'll be the one to notice this particular symptom, because typically these are more violent or active dreams. So maybe you're in a boxing match and you're actually throwing punches or trying to run. So that sleep disorder is another one of those non-motor symptoms. Executive function. Yes, the depression, anxiety is actually a big one too, Amy, because there's been such a stigma around it. Folks don't ask for help where they would with a more physical symptom. So we really do encourage them to do that. And then apathy is another tricky one, but we always try and give people the visual of that glacier, right? The motor symptoms, the slowness of movement, the tremor, the rigidity, the festination, which is the short steps. Those are the top of the glacier. Those are the things you see, but there's so much more underneath that people are experiencing. And those are the non-motor symptoms. So I know we will talk about diagnosis, but when you go to talk to your doctor, whether it's that initial diagnosis or a subsequent visit, it's really important to talk about those symptoms that you are experiencing, because they can only see so much. So that's a vital part as well.
Well, and we advocate for a lot of people, but even in my own health journey, advocating is a huge piece of it. And to your point about things people can and cannot see, I agree. It's so important to make sure that the healthcare professionals have a full picture. And I do understand that depression aspect, because sometimes, even with me, you wonder if people believe you, that you're having these symptoms, you're dealing with stuff because they can't see it. And the same would be with mental health, right? As well, the stuff that people can't see. And so it's so challenging there to kind of get that across. And something I've done in my own journey is just write it all down. Maybe it doesn't happen all at once. Maybe you don't remember it all at once. Keep a running log of things that you're dealing with, so that you can, when you go to a doctor finally, and be like, okay, this also, and all of these things. And then that way you don't have to remember them on the spot. I found as a helpful tool.
Absolutely. Yeah.
So you're talking about diagnosis. So let's jump into that. Like, how does someone get diagnosed that thinks that they might be dealing with this, or their loved one says, maybe this is something that we need to look into? What is that kind of process like?
Yeah, that's a great question. And unfortunately, there is no test to determine whether or not you have Parkinson's. So there is no blood test. You can't get an MRI. You can't get a CAT scan. There's no test that will definitively tell you that you have Parkinson's. They will likely still do a lot of those tests in order to rule out other things. But they, again, when you go to your doctor, they are looking for a few things, those visual cues. They're looking for maybe that tremor or the rigidity or the akinesia, which is the slowness of movement, and postural instability. So the acronym is TRAP. So your doctor would be looking for at least two of those top three things. And if they see that, they will refer you to a neurologist for confirmation. And there is a difference. There's neurologist and there's a movement disorder specialist. So a movement disorder specialist is a neurologist that has that extra training, particularly in these type of brain disorders. So you'll get that referral. Unfortunately, it can take quite a while, as we know with specialists. But from there, they will confirm that. But it's based again on what they're seeing and what you are telling them. So again, why it's very important to share that information. If you're able to go with someone, great. And as you said, Amy, it's a really good idea to have that journal or a diary in between appointments, especially when it can be 6, 9 months between appointments, to write down what you're experiencing so you don't forget.
Fair enough, fair enough. And sorry, I lost my train of thought for a minute. So I was gonna ask you about treatment as well. And one of the things that I've seen when people are looking into retirement living or whatnot is Parkinson's has a very specific, it can have very specific medication treatment with it can be a lot of meds and a very specific. Can you talk to us about treatment and what other treatments we might look at?
Yeah, absolutely. So still the gold standard in Parkinson's medication and treatment remains levodopa. It's a drug that was invented in the 60s, and that's still our go-to in terms of drugs. And just flipping back for a quick second to diagnosis, that's another thing. If they put you on levodopa and you're responding, it's probably means that you do have Parkinson's, because it does work really well in treating Parkinson's. What the levodopa does is it synthesizes that dopamine. So the dopamine that you're missing, that is kind of it's a synthetic dopamine. So that's replacing that, if you will. So that's still our gold standard in terms of medications, and that's what most people will be given upon diagnosis. There are some surgical options. There's DBS, which is deep brain stimulation, and there's a duodopa, a pump, which is kind of worn like a fanny pack, and the medication gets put into your like directly inside, so it's not going through your bloodstream. So those are two surgical options in addition to the medication that's used. Aside from that, we do know that exercise, there's research to show that exercise can slow the symptoms of Parkinson's. So while there is nothing yet that can cure Parkinson's or stop symptoms altogether, the levodopa is what helps with the symptoms. And then we do know that exercise can help slow symptoms, which is fantastic.
We've had someone on my podcast about a year ago or two talking about boxing for Parkinson's too,
Yes.
which is really interesting. I didn't really know that aspect of it, but so she was saying that the boxing really helped her clients and she saw a lot of movement, which I thought was really cool and really interesting.
Yeah, there's a lot of great exercises out there, and certainly boxing and boxing for health. I know is a big one here in Ottawa. There's boxing, there's dancing, but honestly, wherever you are, wherever you're at, whatever exercise you can do, whether that's sitting in a chair and doing arm exercises or one of the little pedal bikes while you're sitting watching TV, whether that's walking around the block, whatever you can do in terms of physical movement and exercise is fantastic. The boxing is wonderful, the dancing is wonderful, but we don't want people to get discouraged and think that if I can't do that, whole big thing, that what's the point? Any movement is wonderful. But yes, to your point, there are so many great programs available to the Parkinson community, which is fantastic.
Mhm. Something that I also see a lot, and I don't know how much you can talk on it, but I thought I'd bring it up. I see a lot of folks that have Parkinson's dementia quite a bit, which is scary. It's you know, it's a difficult disease, and it's really interesting because you're kind of dealing with two different facets. And so I'm wondering, are you able to shed any light on that? But also, are there any other combos that happen with Parkinson's? Because you know, we see folks with Parkinson's all the time, and just to see them also then have dementia on top of it, it's such a struggle for people.
It really is. And it can be frightening and overwhelming, especially when you're newly diagnosed and some people don't want to know, some people want, give me all the information. So it is a lot. So Parkinson's and dementia, it is common. Forgive me, I don't have the statistic in terms of how many folks with Parkinson's may develop dementia as well. But in terms of combos, if you will, there's not necessarily combinations, but under that Parkinson's umbrella, there are other Parkinsonisms. So those are more atypical Parkinson's, which are in the Parkinson's family, but look a little bit different. For the most part, it's the progression that is the difference. It progresses much quicker with those Parkinsonisms. So those are under that Parkinson umbrella. But yes, we do see dementia develop quite a bit in folks with that slowness of movement and slowness of thought. That does contribute eventually. So it is something that we see, and it's very unfortunate because, like you said, it is almost as though you're now dealing with two things. But again, everyone's different. Like I said, it's that fingerprint. So, we have support groups and different supports available, and some people might go to a group and see someone experiencing something and get a little bit scared, but they may never experience that themselves. So if you're hearing things and reading things, we try and remind people not to worry. It might not necessarily happen, and if it does, there is help and support.
Mm-hmm. Sort of when we're advocating for health in general, right? Sometimes it feels like the wild, wild west out there, right? And it's just trying to piece it together, whether it's for yourself or with your loved one, trying to help them piece it together. It's just so challenging for families.
Yeah, absolutely.
So let's talk about progression and care needs. So a lot of what we work with is in the housing. And when we're looking for individuals that have Parkinson's at any level, but we're trying to do kind of progressive planning, right? And we're looking for continuum of care, because in what I do, I've seen a lot of folks that are that have Parkinson's, as it progresses to later stages, need a lot more care, a lot more physical help. One of the terms is two-person assist or two-person transfer, meaning that it takes perhaps two PSWs or two people to really help that person move around. And that's why we always look at a continuum, because like you said, everybody's different. Nobody kind of progresses the same. And so really trying to make sure that we've kind of aced out all of the things that could make someone move if they don't want to move, right? Like, definitely people that move from retirement to long-term care or from home to long-term care, like that's all happening. But a lot of people choose to go to retirement living. In Ottawa, we're very fortunate. We can actually have quite a lot of care in retirement, but what I find to be important is really making that plan. Because even though we don't know how it's going to progress for everyone, it's still, there's some common elements, wouldn't you say? Like how
Yes,
people
absolutely.
planning for the progression.
Yeah, that's a great question, because there are a lot of commonalities, and there are things that benefit everyone no matter what. Like like I said with exercise. So certainly in planning for the future and looking at a retirement residence or home or whatever that may be for yourself or your spouse, some of the things to keep in mind, maybe in the earlier stages, are that recreation calendar. So are there some exercise opportunities? Are there opportunities to socialize, to try and combat that mental health aspect? Voice was another one I didn't mention, but that's another non-motor symptom. So your voice can start to go, and it can start to go almost to a whisper, but it feels like you're talking like I am now. That's what it feels like to the person, but it's coming out as a whisper. So voice, things like singing, if there's a choir, if there's voice therapy, to try and combat these non-motor symptoms. So If you're looking for somewhere that's got a great recreation calendar and they have all these types of activities that are beneficial to you now in slowing those symptoms, that would be a great thing to look at. We often tell people with Parkinson's to try and build your healthcare team. So it's not just that doctor and neurologist. There might be, as I said, a speech language pathologist. There might be a dietitian because certain foods may be better for you, and especially if you're dealing with that loss of taste and smell, or constipation. So you might have a dietitian on your healthcare team. There might be a physiotherapist. So these are all questions to ask of somewhere where you're going to live. Is there someone on site, or do you have someone coming in once a week, or do you have connections to someone that I could work with? These are all things to ask maybe in the earlier or middle stages. And then, as you said, trying to plan ahead. We don't necessarily always want to look that far ahead, understandably, but if you're planning ahead to maybe the later stages, if there is somewhere that has that assistance, as you said, and that type of care, and a little bit more care when possibly the swallowing issues, as an example, become too much, and swallowing even your own saliva, let alone food, becomes an issue, and maybe diet is a big thing and they need assistance there, or a two-person lift, as you said. If movement becomes even more and more of an issue as it progresses, these are things to look for in the later stages. So certainly, no matter what stage you're at, if you are trying to plan ahead, there are a lot of different things that you can look at when looking at a home.
I always learn stuff on these webinars as well, right? Because this is not my expertise, but we see a lot. And the specifically about the voice and the singing and stuff is really interesting to me. And I'm gonna put that in our own toolkit because it wouldn't have been something we would regularly be looking for. We're looking for a lot of the physical stuff, care and whatnot, and socialization and stuff, but specifically the singing and the voice work would be really interesting for our
Yeah.
clients.
Yeah, absolutely. And that particular one, we always tell folks, even if your voice is fine, you still need to exercise those vocal cords. So it's just like, you don't, if you don't use it, you lose it, that saying. So it's same with exercising your body. Just because it's not happening to you yet, prevention is great too. And oftentimes with a lot of these choirs and singing groups, they say you don't need to be talented, just come and have fun. And that's really what it's all about. And then exercising those vocal cords. So it's great.
Awesome. What about types of support available to people? So, I mean, we have people joining us from everywhere, as I was mentioning before, and even across the world. So, I'm guessing there's online support and also maybe talk about local support for Ottawa as well. Like, what can people look for?
Yeah, that's a great question. So before I get into what our organization can do, just to circle back to the healthcare team. So that's, having that supportive healthcare team and knowing who you might need on that team is a great source of support. If you're lucky enough to have friends, neighbors, family nearby, that's wonderful, of course. There are local exercise programs, as you've already mentioned, and a lot of them, even though it starts as exercise, do become very close, and they might go for coffee after, or have that, a support group meeting afterwards. So a lot of those types of groups are fantastic as well. In terms of Parkinson Canada, there are a lot of different things that we offer the community, specifically here in Ottawa and Eastern Ontario. There are those support groups. As you said, there are virtual offerings, but there are also in-person offerings. So whatever your preference is. There are multiple languages offered. We do have French language, English, Mandarin. So there are several different options there in terms of language. There are also support groups for care partners, because we know that your journey is very different and you need a lot of support. So there are support groups for care partners, or support groups for adult children care partners. If your parents are living with Parkinson's, there are support groups for care partners of those living with atypical Parkinsonisms, the ones that we were talking about earlier. So a lot of diversity there. There's support groups for our living solo support group. If folks are living on their own and with Parkinson's, their journey is much different and they have a whole new set of struggles. So a lot of different groups, no matter where you are at, to support. So we have those. And then if a group setting maybe isn't your thing, that's okay. We offer peer-to-peer support as well. So again, care partners and people living with Parkinson's, we will match you up with a mentor who has maybe similar interests or is going through something similar. Whatever you'd like in a mentor, we will do our best to match you up. And then you can chat with them at your leisure. So our peer-to-peer programs available. Our information and referral line is here Monday to Friday. They're made up of a team of fantastic people, from social workers to nurses, that will help you navigate things and what next steps might be, and refer you to resources. We have several print and digital resources that we will send you for free, or you can read or download online. We have the Care Finder, which is relatively new. So this, if you're computer savvy, if you're here today, you must be somewhat, but if you can go on the computer and log on to Care Finder, you can search by the type of provider you're looking for. If you're looking for a dietitian, you can search by your postal code if you want to see different care providers that are near you. So this is a great tool to help find people in your area. We have monthly webinars, educational webinars with different experts in their field that are talking about all things Parkinson's and how to live well. And then we have health and wellness programs that we offer to the community. For the most part right now, these are virtual because we can reach the most people, but these are either free or low cost for the Parkinson's community. So there's a lot of different things. I encourage you, as a first step, just to call our information and referral line or visit the website at parkinson.ca, and they can help point you in the right direction for whatever your needs might be right now.
So much support out there. Like there's that's so much, which is amazing. And I think that, it's really important, not only that you kind of listed all that, but so that people see that they're not alone. We work with a lot of people. We work with caregivers, and we work with folks that have Parkinson's or their loved one. And that's one of the main things. People feel that their journey, even though Parkinson's can develop differently, a lot of people feel like their journey is only them. And that's even with Parkinson's Canada and what we do, that's something that I think all of us as professionals are always trying to educate, that you're not alone, that your journey might not be exact, but it's the second you look for anything, or the second you start talking to colleagues or whatnot, or other people in the community, quickly people find out others are having these types of struggles or similar that can overlap, right? And it's really important that the people watching our webinar or listening to us understand that, it takes a minute. You just have to look or contact, us or you guys or whomever, just to make one reach out, and you'll really quickly find that you're not alone, and that there's others that are really in the same ballpark. And I love that you also have peer-to-peer, and not just group, because even for myself, even when I look at coaching and things like that, I'm not a big group person. I'm very much one-on-one, and there's lots of people, and especially after COVID, a lot of people were isolated, and a lot of people like myself kind of went into their own shell, and it's hard to get out again. And so that one-to-one is really important, I think.
Absolutely, just to have that option. As you say, it can be intimidating, and it can be isolating, and we don't want that for you and for anyone. But making that first step, that first phone call, that first click can be intimidating. But I can tell you, so many people, when they've come to support groups or they've called us, oh my gosh, I wish I had done this sooner.
Right.
So, if you can get over that hump of it being a little bit intimidating, it's wonderful on the other side. A lot of support.
Absolutely. So we've got a couple of questions. So I'm going to look at my other monitor here. If you have questions for us or Krista, put them into the chat, and I'm going to go through them and ask, and then that way we can address them. So Melanie wants to know, what are the top recommended long-term care homes in Ottawa for patients with Parkinson's? My mom has Parkinson's, the aggressive version, MSA, the aggressive version, and her health is rapidly declining. We did a list of recommended homes from Tea and Toast, but looking for top resources. So from our point of view, in the long-term care arena, the care is supposed to be standardized across the board, right? So in Ontario, there's a certain level that all the homes are supposed to be at, and none specifically stand out to me from long-term care or retirement. And in retirement, I would say that we're looking at care levels. So that would be a stipulation there. Whereas long-term care, the care levels are supposed to be all standardized. And so reputation always comes into it, right? There's homes that are better than others for reputation, but general care, as a housing stipulation is standard. Where in retirement, like I said, we'd want to look for the homes that could do the full continuum because they would be more used to people progressing and needing more care. Krista, do you have any comments on that specifically? Do you have any thoughts?
Yeah, I can't speak to homes in Ottawa necessarily around Parkinson's care. Just to reiterate, perhaps what I said earlier, and looking for different things that they may be able to provide that you need now or will need in the future. And just talking about MSA, that is one of the Parkinsonisms. So I'm sure you've already been in touch with, but just in case, PSP Canada is an organization, a national organization that deals specifically with those Parkinsonisms. So they might have some more information on specifically what you should be looking for and things that you might want to tick off that list. So that would be a great organization to get in touch with if you haven't already.
Awesome. Next question, is marijuana used to help control tremors?
That's a really good question. So there's not a lot of research, unfortunately, because it is relatively new that it's been legalized, and it's still a bit taboo, unfortunately. So there's not a lot of researchers that are jumping at the chance to do some research. However, what I can tell you is anecdotally from visiting the community and different support groups and talking to people that have used CBD oil specifically, some have said yes, oh my goodness, it helped me. Others have said not so much with my motor symptoms, but boy, did I sleep good. And then when they had a good night's sleep, again, because you've got that REM sleep, it's often interrupted. That can snowball into I had a great night's sleep, so I feel more like exercising, which again helps the symptoms. So take that with a grain of salt. It's not officially something that is recommended just because we don't have enough research to say one way or another that it's helpful. But anecdotally, I've heard some people say that it is, and others have said they didn't notice. That said, what I will say, please don't go to your neighbor's uncle and ask for some. Just go somewhere like there is the Ottawa Cannabis Clinic, I believe it's called. There's 3 different locations throughout Ottawa, and they have doctors, nurses, counselors on site that will help you. If you've asked your doctor for a referral and they're saying no, 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 you can self-refer. So if you still want to say, well, I owe it to myself to give it a try, absolutely, you can self-refer, and they will work with you based on what your symptoms are, and what your needs are, and they will find the right dosage, and they will keep going back. If maybe you're doing a capsule, it's not working, maybe they'll try an oil under the tongue, maybe you need 2 drops instead of 1. So they will work with you to find that perfect balance. And like I said, they have doctors and nurses on site, and all of that information is kept on a record, and that it will be shared with your family doctor, whether they referred you or not. So it is, some people have said rather than having another drug, another chemical in my system, this is a bit more natural, and they like that. But in terms of an official stance, we haven't been able to take one just because there's not enough research there to support it just yet.
Mm-hmm. Yeah, and that it is a hard one, right? Because people use it for all sorts of things, even outside of Parkinson's, right? The appetite and all sorts of things. And I think, again, I'm not an expert on that as well, but generally speaking, it comes down to that advocating for yourself as well. And kind of to your point about not all doctors will look at that. Not all doctors are on board. It's legal, but not all doctors are on board. And that's a hard thing as well. And so, I would say, find someone that is willing to listen to you in that profession. And like you said, self-refer or whatnot. If you think it's gonna help, then it's probably worth looking into and not just stopping because maybe your doctor said no. Because not everybody's on board with this very specific topic, right? So I think that's interesting as well. Victoria says, my mom has Parkinson's, dementia. I don't meet many people that experience hallucinations. Would hallucinations and paranoid delusions be from Parkinson's or dementia? And do you have any tips to deal with it?
Oh, it depends. So it could be from either. It could be from both. It could be from either. It is often a side effect of Parkinson's medication. It could be a symptom. I would first ask if the hallucinations are frightening or uncomfortable. If it's just a matter of seeing a cat over there that's not really there and it's harmless, maybe it's something you just play along for now. If they are frightening to the person, or worrisome because maybe they see someone and they want to go follow them outside, then it might be time to talk to, if not your doctor, because as I said, they're sometimes tougher to get into, but even a pharmacist. If you go to the same pharmacist and they can see all the drugs that you're on, they might have some advice if you can't get into a doctor. But it could be a side effect of the medication, or if the hallucinations are already present, it could be a medication that's maybe making them a bit worse. So I think my first thing would be to look at the hallucinations again. If they're pretty harmless and you're okay with it and they're okay with it. If not, I would maybe look at those medications if any of them are contributing, if there's anything you can do, if there's alternatives that are similar to treat, but maybe don't cause those hallucinations, or if you can play with dosages. That would be my suggestion if they are bothersome. But again, don't play with any dosages or anything until you speak to a doctor and or a pharmacist. It's not something you should ever do on your own, but that would be my suggestion, because it can be a symptom of both Parkinson's and dementia, and you've also got the medication that it's a side effect. So I would certainly talk to a medical professional if it's bothersome.
That's troublesome that it could come from multiple directions, eh? That's very tricky. So, even a med review in general is always good, right? Because lots of people are on medications for years and assume, right, that, it's not gonna be that. But like to your point, it totally could be some kind of medication doing something, or you've changed as a human
Yeah.
to change it, right? And so just having that regular review would be helpful.
Absolutely. And once you start introducing more and more symptoms, if you're on that levodopa as a base, and then maybe you're treating a depression with a medication, maybe you're on something for your appetite, or there's a low blood pressure, maybe there's something not Parkinson's related you're on medication for. These can all play into each other. So it is really good, excuse me, to get that looked at every now and again, and especially as you're playing with dosages. So as Parkinson's progresses, for example, that levodopa dosage might increase, or the time increments might decrease, or both, which could change a number of things. So always good to kind of look at that every so often.
Good stuff. Okay, does anybody else have any questions? We've got some thank yous. So thank you, Krista, for coming on. I really appreciate that. I'll just leave it for one more second. Perfect.
Thanks so much for having me, Amy. Appreciate it.
Thanks, Krista. All right, everybody, have a wonderful day. Take care. Thanks.